the Toronto Star. I'm Saba Itazaz, and this matters. Roots, culture, heritage, history, and generational trauma. It impacts a person's beliefs, norms, values. And in the case of mental health, it can mean the difference between seeking help or not, sometimes between life and death. A joint investigation by the Toronto Star and the Investigative Journalism Bureau has analyzed key mental health indicators for First Nations youth across Canada, including antidepressant prescriptions, suicide attempts, self-reported disorders, and access to support. The results are disturbing. The suicide rate for First Nations people under age 25 was roughly 6 times higher than the rate for non-Indigenous Canadians of the same age between 2011 and 2016. For First Nations women and girls, it was 11.5 times higher. The reporting revealed a painful truth that First Nations people already know. The system is strained, inadequate, and not designed to respond to the growing distress calls of desperate young people. And while Indigenous youth in Canada suffer from some of the highest rates of suicide in the world, proven culturally relevant counselling and community healing practices are few and hard to access. Star investigative reporter Robert Cribb was a part of this joint project with the Investigative Journalism Bureau, and it's part of a Toronto Star series called Generation Distress. He joins me now to talk about it, why Canada's First Nation youth is in crisis, and what needs to be done to address it. Hi, Rob. Nice of you to join us again.
Good to be here. Thanks for having me.
So I know you've been looking at mental health indicators in Canada's youth as part of the Generation Distress series, and there's been some disturbing revelations from that. Can you first of all tell me a little bit about this joint investigation that was with the IJB and the Toronto Star?
Yeah, Generation Distress is well over a year now of research and reporting on youth mental health across the country, different communities. It's obviously become a widespread public health issue. We're seeing it everywhere. All the metrics on this are breathtaking and spiking in ways that no one's ever seen before. And so the Investigative Journalism Bureau and the Toronto Star have been fanning out, digging into numerous angles and tentacles of this story and trying to tell kind of the human piece behind it, but also bring to light some never before published data, gathering our own data, building databases, and trying to bring both a kind of a statistical and human portrait of what's happening, which experts in this field sort of unanimously believe is a true unprecedented moment.
Mm-hmm. And when you analyze the key mental health indicators in terms of Indigenous youth, did you find that the numbers were comparatively worse? What were some of the key findings that stood out to you in that context?
So this latest story is specific to Indigenous youth, First Nations youth, and we went out and it took us a long time to gather this data. It is not readily available and has not been assembled in the way that we sort of wanted to tell the story. So we had to kind of start from scratch. And it took many, many months to gather it all. And in the end, what it shows on virtually every metric that we were able to measure, from depression to substance abuse, self-reported PTSD, suicide, antidepressant prescriptions, Indigenous youths are conspicuous and disproportionate in those numbers, in some cases dramatically so. And so, in all, it paints, obviously, a very disturbing portrait of this particular segment of youth mental health.
Can you talk a little bit more about, you're talking about the difficulties in accessing this data. Does that speak to the fact that there is very little race-based data that is available on these issues?
Yeah, it's really tricky. I was actually surprised how difficult it was for us to assemble this. Race-based data, as you know, is always tricky, right? So lots of organizations, institutions, governments don't keep it at all. Where they do, it's often flawed. And so it took a lot of work to get this. We had to file a number of freedom of information requests, work with sources across the country. It was a lot of work and a real slog. And it really sort of showed us how difficult it is to kind of measure this particular segment of the population, which is, I think undeniably the most vulnerable. And by all indications in the data, the one that we should be looking at most closely. And yet it's pretty hard to do.
And I want to break down the numbers a little bit because, as you found in the survey, all of them were really worse for this demographic in particular. And you also found the suicide numbers in this survey as well. And this is something which has been documented and written about this Indigenous youth facing a suicide crisis. Can you talk a little bit more about some of the latest data on that?
Yeah, we found First Nations people under the age of 25, roughly 6 times higher the rate of suicide than non-Indigenous Canadians of the same age. So that's data between 2011 and 2016. It's worse, in fact, for young girls and women, 11.5 times greater suicide rate than for non-Indigenous women and girls. So, I mean, these are, obviously breathtaking numbers. We see them as anecdotes from time to time in news stories, but really to sort of see the scale of it and the obvious discrepancy is sobering at best. And when you think about what the stakes are in this, I mean, the humanity of this is really so deeply troubling. This is a level of mental distress in very young people that is leading to the worst possible outcomes. And at the end of the day, these are numbers, and numbers are numbers. But when you really sort of think about what does that mean and what kind of society are we living in where this is allowed to continue, it really does raise a lot of powerful questions, I think, that need to be at the forefront.
Right. The numbers clearly point to a much deeper story that's playing out in Canada. I also want to talk about something that really stuck with me. You said the numbers in terms of the crisis are worse for Indigenous youth, and yet you also found that First Nation students were the least likely to seek help out of all the ethnic groups that were a part of that survey, right? Why is that?
Yeah, that's a really interesting question, and there's lots of theories on that. I mean, we highlighted voices in our story. One of them is sort of our main character, Jacqueline Carr, and she from a very early age dealt with mental health challenges, and she went to the same kinds of resources that any of us would or any of our children would, and ultimately found that they were not responsive, they were not sensitive to her unique needs as a First Nations person, and ultimately turned away from it. She did not receive the kind of support through the traditional kind of Western-based approaches to this problem that she needed. And what we've heard is that that's very, very frequently the case. And when there's a turning away of that kind, word spreads, there's a feeling of hopelessness about it. And when the only help available is help that is not responsive to your particular needs, your culture, your indigeneity, then, that could be a big part of it. And that's certainly what many experts told us.
Mm-hmm. And you mentioned Jacqueline Carr, and I think you illustrate the struggle to find help quite well in that story. Can you talk a little bit about what her and her family sort of went through before she eventually had to seek out her own path to healing, right?
Yeah, I mean, she did what most Canadians do. She ended up before doctors and psychologists and social workers and got the kind of traditional Western-based approach that is standard in this country. And it clearly did not work for her. She continued down a path of mental health deterioration, I think it's safe to say, which included multiple suicide attempts, depression, PTSD. She is in many ways the face of this data. And that's continued. And that's, from a very early age. She's now 20 years old. And it's only in the last little while that she rediscovered connections to her culture. She lives in a First Nations community near Peterborough called Hiawatha. And she returned to drumming and singing, connections to the land, counseling from elders. It's this reconnection that she talks about that has really had far greater positive impact in her journey than any of the medical interventions that she had throughout the course of her younger life. So it was a revelatory moment, I think, for all of us working on this story. In speaking to her, it sort of all came alive for us. Like this was a real live voice and human experience that in many ways illustrated and enlightened the kind of data that we were seeing. And there is an actual, significant body of research and analysis on this that shows that she is by no means alone, that these reconnections through traditional cultural healing are far more effective than calling up the psychiatrist or the psychologist or the social worker and doing 2 meetings a week.
We'll be right back. And you are talking about the Western-based approach, this kind of one size fits all. And now there is conversation about how that doesn't apply to all ethnic communities, to all demographics. Can you talk a little bit more about the Canadian mental health care system from all that you are saying from your report and the statistics? Has it failed Indigenous people, both in terms of how it's designed and also in terms of the access?
Well, has it failed? I mean, I think that depends on who you're talking to. I would certainly say that those in the Indigenous community that we've talked to would say 100% that it's failed. It is and continues to fail. These numbers that I just talked about are as compelling a body of evidence as you need to make that case pretty strongly, I'd say. So I don't think there's any question that there is a consensus around the fact that this has not worked the way it's existed over time. And this particular generation, I think, of Indigenous young people is perhaps the most illustrative of that. I mean, it's a very difficult time in terms of youth mental health generally in the population. There's been spiking rates across all ethnicities. There's no question about that. But, the fact that the starting point for Indigenous youth is so much worse, it really is the tip of a very sharp point. And so, again, what do you make of that? And the obvious evidence, and both statistical and in terms of research, would suggest to us anyway, that there is a different response in the Indigenous community to the common models, the existing models of youth mental health care that exist. And as a result, the results are different, right? So we're seeing different results and different levels of outcome among Indigenous youth than we are non-Indigenous youth. And so it stands to reason that there needs to be a reassessment of how individual treatments can be tailored to those who need a different approach that's more cultural, traditional, and understands the differences in those young brains.
And obviously, there's the historic aspect of trust as well. And when we talk about some of the root causes, when we look at this crisis, how much does generational trauma from the impacts of colonialism play into this and the fact that the Western mental health care system is still kind of operating through that lens?
One of the sobering things here is that all of the numbers that we gathered and presented in this story predate the discovery of, more than 1,000 bodies in residential schools. And so, one can only imagine, and it's certainly being theorized, that anything that we've actually documented to date is going to be exponentially worse with this traumatic and unthinkable discoveries. And they continue, of course. And I think we've all heard about the kinds of traumas that that's triggering. So think about all those numbers I just talked about, and then think about what they might be now, after the discoveries that we've already heard about and those perhaps yet to come. And so researchers, and certainly we interviewed kind of every leading Indigenous voice that we could find in the research community. And there is no question that to a person, they cite the impacts of colonialism.
The ongoing impacts, like you say.
Yeah, absolutely.
It's not in the past.
You cannot separate those effects from what we're seeing in these numbers. And so there is no question, I think, in the minds of those who study this and are focused on it, that there is a direct line to be drawn from A to B on that.
You also reported on this massive increase in mental health prescription claims for Indigenous youth. Can you walk me a little bit through what you found on that front? Why is this happening, and are there impacts to that as well?
Yeah, this was a really unique data set that we'd never seen before. And in fact, we gave this to a number of our experts and they hadn't seen it before. So it was quite revelatory for us. It took a lot of work to get it. We had to file Freedom of Information requests to Indigenous Services Canada. And, we think it's a really important find. So here's what it shows, basically. The number of mental health-related drug claims, so these are antidepressant drug claims for Indigenous youth under 18, tripled from 2009 to 2019. So in that 10-year period, we had a tripling of those prescribed medications. Most commonly SSRIs, which is a sort of a category of antidepressant. And they're most typically recommended for children in combination with talk therapy. So the idea here is that it's a prescription drug to be taken in concert with talk therapy, with a social worker or a therapist, et cetera. But overwhelmingly, what we heard from Indigenous leaders and mental health researchers is that those services, and we know this to be true, are desperately lacking. So the talk therapy element of this is expensive. It is hampered by lack of resources and a lack of, particularly in small remote communities, the process of trying to get appointments and access to counseling and therapy. It can mean months, many months of delays. And so the reality of that is that we're talking about medicating this generation of young people at a dramatically increased rate without providing the kind of talk therapy that is meant to accompany that medication. And that, for a number of people that we talked to, was very striking and sobering. And, obviously our hope is that it raises this issue in a way that might inspire some thoughtful consideration.
Yeah, and let's talk about solutions since this conversation is now happening. Are there ways being discussed to adapt these existing treatment models to be culturally relevant, to be in context to particular communities? Are there any success stories out there or, where an alternative method is being deployed?
Well, I think this is where it gets super interesting. Certainly for me, digging into this story, I thought what was so revelatory is that the unique ways that are starting to be discussed and studied and to some extent adapted, but on such small scales that, it's not made a dent in, of course, the overall cumulative numbers. One of the most fascinating things that we found was this case in the Cowichan tribe in BC. So between 2007 and 2012, they saw an increase of more than 2.5 times in suicidal behavior. So it was this dramatic spike. And they're certainly not alone in that. We saw a number of communities where this was happening. So here's what's interesting. So tribal leaders declare a local state of emergency. They bring in this researcher from the University of Washington, Emma Elliott Groves, who herself is Indigenous from that community. And she conducts this very unique study that incorporates traditional sort of Western-based approaches, but adds on this layer of culturally sensitive practices and elements to the research. And what she identifies in the study, which was later published in 2019, is this really fascinating difference in the way we, as white Western Caucasians, look at mental health issues and the way Indigenous communities look at it. And she articulates it in this way that Western concepts of mental health focus on individualism and autonomy, right? So I feel depressed. I'm going to go seek counseling that is going to help address my depression. Indigenous practices, she writes, value extended family relationships, authority in elders, dynamic notions of time and space, spirituality. And so she adapts this study to bring in those elements in this community. This was undergoing a dramatic increase in suicidality. And so they did things like engaging youth and families in nature walks led by a medicine person, and art therapy sessions, and in-depth interviews asking young people about their relationships to the community to gain access to their understanding of their states of mind and their psychiatric illnesses and family connections and religious beliefs in the afterlife. All of these elements that are in no way what we would typically get in traditional Western-based approaches. And, it was an absolutely fascinating revelation, and it's been incredibly successful. There's other examples. There's a leading example that everyone talks about out of Arizona, the White Mountain Apache Tribe Reservation. They adapted, again, same deal, cluster of youth suicides, early 2000s, panic in the community. The tribal leaders order an analysis, and they create this surveillance system that triggers referrals to treatment and in-person interviews, talk therapy with mental health specialists. And it kicks in immediately. Young people are identified. A suicide prevention plan kicks in. And it's been incredibly successful. The suicide rates have dropped 40%, including 25% reduction among youth, age 15 to 24. These are extraordinary examples of how to do this right. But they're anecdotes, right? They're related cases. That's the problem.
Like you said, these examples are there, but they're few and far between. How important is it right now at this juncture for there to be widespread policy level changes along this context and for colonialism, racism, and transgenerational trauma to be a part of the conversation when we are talking about mental health care and adapting it to encompass and look out for Indigenous youth?
Well, of course, one of the great hopes of doing this story and spending this much time and care on this story is, of course, to raise that discussion and that debate. Of course, we do this work because we think it is absolutely past time to talk about these things and address them in ways that are helpful. And that's what, we don't just lay out the problem in this story, in this investigation. We went and explored the possibilities here and where it's working and found jurisdictions where it's not theoretical, it's working. Like it's worked. And so at that point, what's left to talk about? Like if we know that there's a way to address this, if we know that the system is broken and is currently putting young lives at risk, like what higher stakes are there? And so if there is a way forward, which there is, then why would that not be part of the discussion? And we're just not seeing it. One of the reasons we did this story is because We go on and on, the stories every day about all these problems and the suicide rates and the clusters. And that's all it is. Like, we just talk about this endlessly. And yet, like, where's the discussion about next steps? And a lot of these things are not big, expensive, massive, decade-long projects. These are just good, smart ideas that can be worked into the existing system in ways that could be transformative and like save young lives. What more important endeavor is there in terms of public policy?
Absolutely, that makes sense. You've raised some really important and urgent questions, Rob. Thank you so much for your time and for doing this very important investigation.
I'm grateful. Thanks so much.
I was talking to Robert Cribb. He's a Toronto-based investigative reporter for The Star. That's it for today. Thanks so much for listening. I'm your host, Sabai Tazaz. The This Matters team is Brian Bradley, JP Fozo, Matt Hearn, Morgan Bucknick, Raju Mudhar, and Sean Pattenton. Our music is by So-Called, Mike DeAngelis, and Sean Pattenton. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com/subscribingmatters. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.